Okay, I hope everyone's okay with that. So again, oops, let's let one more person in here. Let me share my screen again. So welcome everybody to Health Council Talks for today. We're going to hear from Dan Green from the Department of Health and Becky Kilburn, Courtney Fitzgerald from UNM Prevention Center about the Youth Risk and Resiliency Survey, which I know some of you are already familiar with. Let me let some more people in here. And but we're going to hear more. And we're also going to hear how you can help Dan and his team get this information gathered and out to folks.
Yeah.
Right. So we're going to start as usual with our
turn your computer down. Good heavens.
Say what? Somebody's talking to us?
No, I'm sorry. I'm trying to turn my computer down.
Oh, okay. Okay. As usual, we're going to start with our land acknowledgement. So the New Mexico Alliance of Health Councils humbly recognizes and acknowledges that we are on the unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities, while at the same time strengthening and respecting our relationships with Indigenous people. We give thanks to the past, present, and future stewards of this land, and we respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes and nations who are still here today. So thank you for that. I'm going to stop sharing. I'm going to let a few more people in. And Dan, I am going to turn it over to you. Take it away.
Okay, thank you, Wendy. Let me just get my screen up there. I hope you can. I think you should be able to see my screen now. So great.
Yes, sir. We see it.
Okay, good. Well, thank you, everybody. My name is Dan Green. I'm with the New Mexico Department of Health. I do several things for the Department of Health. My main thing is that I work on the Youth Risk and Resiliency Survey. And I do so, I work very, very closely with my two colleagues that are here today, Dr. Becky Kilburn from the University of New Mexico Prevention Research Center, as well as Courtney Fitzgerald from the Prevention Research Center as well. And so I'm very glad that they're able to join me here today, and thank you all so much for inviting us to this meeting. County health councils are some of the most intensive users of the YRRS data, and we want to thank you for that. And I think a lot of this presentation does assume that you know quite a bit about the survey and have used it, but we will go through some kind of introductory stuff as well. Anyway, while most states do similar surveys, and they are interested usually in producing only state level results. And in New Mexico, we are interested in producing results that are useful at the regional level, the county level, and the school district levels. So groups that are organized at the local level, such as the health councils, are really our primary data users and our most important source of feedback. So we do listen to what you guys at the county level are saying very closely. And this presentation is about how participation leads to results. And what we really want to get across to everybody is that good, strong participation leads to good, accurate, and useful results from the YRRS data. And this year we are facing some challenges with the YRRS participation that we haven't faced in as much in some of the most recent years. And we'd like to get your take on what's going on, and we'd like you to consider what health councils and other local groups can do to support strong YRRS participation. So we'll just start real briefly. And again, I think everybody is mostly pretty acquainted with the YRRS, but we'll just go through this a bit here. So what is the YRRS? It is a biennial survey of public high school and middle school students. We've got a number of partners, important partners. The CDC Division of Adolescent and School Health coordinates all the YRBS surveys nationally. We've got a number of state level partners. The Department of Health, Public Education Department, and the UNM Prevention Research Center are the primary local our state level partners. We also work closely with the Behavioral Health Services Division, the Albuquerque Area Southwest Tribal Epidemiology Center, or ASTEC, which gets us good representation from tribes. The Navajo Nation YRBS has a similar project that they work on, and we work very closely with them to get both of our surveys done at once, and we support each other in that. And then primarily though, our main partners are school districts and schools and people at the local level. So we do realize and want to acknowledge that this survey is a burden and quite a bit of work to a lot of the schools and school districts, and we have had some very good participation in the past. We want to see that going forward, and we want to increase that participation, and we want to make sure that people are getting the data that they need. And with that, the school districts and schools, I think other local area partners are really helpful in the whole process. The YRS is a part of the Youth Risk Behavior Surveillance System, or YRBSS. That's, again, the Division of Adolescent and School Health, Centers for Disease Control and Prevention at the CDC. They do this survey in most states and a lot of larger school districts. So there are three components of that system: the national survey and the individual state and territorial surveys, and large local education association surveys. Each one of those three levels is a youth risk behavior survey. And then we combine our New Mexico state data with them. The upshot of all of this is really that when you hear about the YRRS in New Mexico, and when you hear about the YRBS, it's the same thing. The YRRS in New Mexico is one of the youth risk behavior surveys that's conducted in most states and nationwide. In New Mexico, we are unique. We always like to say in New Mexico how unique we are, but we are, in this case, very unique. We have a very large sample in New Mexico compared to other states, and we are able to get at the local level. We do an oversample of American Indian and Alaska Native students, and we get an oversample of rural students in rural areas. Again, most states cannot get down to these local areas like we do. We also have resiliency and protective factors on our survey, which is something that most states do not include. It's just a risk behavior survey. Well, we are a youth risk and resiliency survey. The types of information that we collect are risk behaviors. The core of the survey contains risk behaviors. That's what makes up most of the list on this slide. And then very importantly, we also ask about protective factors or resiliency factors. So these are the relationships between students and their families, school, peers, and communities. And we also ask a limited number of questions about health outcomes. These are things such as asthma and obesity. And of course, we also collect basic demographic information on all the respondents that are represented in the survey. So who uses the YRS data? Well, it's used at the national level, again, by the CDC, uses it for planning and putting out programs nationwide. It's used at the state level by policymakers, by legislators, by the Department of Health, Public Education Department, Human Services Department. So a lot of state level planning and state level priorities come and are informed by the data that we collect with this survey. And then most importantly, again, the local and regional level users that we have. So we have program planners, schools and school districts, school-based health centers use our data. And of course, the county health councils, county DWI councils, and there are a number of other county and local groups that do use the data. And so what do they use the data for? Well, it again is used for state policy and legislation. It's used for program design, targeting programs, implementing programs, and evaluation of programs. This is both at the state and the local, county, school district levels. And very importantly, especially for a lot of local areas, it does help to attract grant funding for state level, regional, local level prevention programs. So a lot of counties and a lot of different programs do have funding for programs that they would not be able to get so easily if it were not for the YRRS data. So that's kind of a quick introduction to the survey and what it is, what it does for us in New Mexico. So the main purpose of this presentation today really is we do want to talk about YRRS participation and how do we get from the data that I hope a lot of you have been to a lot of the presentations that we've given. And a lot of you use the data. But what we really want to do today is talk about how do we increase our participation throughout the state. This is what our 2021 participation looked like. In middle school, we had 16,000 respondents. In high school, we had 16,000 respondents, a little over 16,000 respondents in both. So this is 74, 75 of the 89 school districts in New Mexico. And you know, over 200 schools altogether. So this is a huge effort, a lot of participation from people statewide. And I think we've been estimating that, you know, 60,000 people or so are involved in this survey once we get all of the people, the respondents, the teachers, the parents, everybody who has anything to do with this survey involved. It's really a huge effort. And so we have had very good participation over the years. And I just wanted to kind of go over how that participation is looked at the school district level and how it is looked over the years at the school district level. So this is a chart, and this is a PDF file that I'm not sure, Wendy, were you able to distribute this file yet? Or
No, we'll have this available for people though after the presentation.
okay, great. This is good. So this is what this is it's a document that looks at YRBS participation since we started, YRRS participation since we started the survey in 2001. And every time we've done the survey through 2021 and then the 2023 plan. So we are going to implementation this fall. It's organized by public health region. And so this first page that we're looking at is the Northwest region, and the counties in the regions are Cibola, McKinley, and San Juan, and then the school districts in that area. We've got kind of a little brief look at how they participated in the survey. And you can see that most of these school districts in the Northwest region have participated in the survey every year. We've done it since 2001. So that's 20 years of data. So these school districts have really great trend data, and they can look back a long way at how things have been going in their regions. Then the only, yes, so right, and that's the X's. The X's are the school districts that have participated in each of these years from 2001 to 2023. The red squares are for years that they didn't participate. So you can see that we had difficulty getting Aztec School District on board for the survey for the first several years of the survey. And since then, they've been really strong participants in the survey and very, very interested in their data. And we'll see a couple of school districts as we go along. These are red, but they have an A in them. That means they accepted participation in the survey, but we actually didn't end up getting data from them. And we'll talk about a couple of those. So the 2023 column, we have the green X's. So these are the people who have agreed to participate are the red X's. And then we have kind of a concerning issue here with Farmington School District. And Farmington has had until 2021 a perfect record of participation, and strong participation at that. They're pending right now because they've gotten some pushback from some people in the community and from local politicians, they say, and mainly the issue is around gender identity questions, that people are questioning whether those are appropriate for the survey. We have talked to people in that community, and we do anticipate that Farmington will come back on board, but this is the first year that we've ever had an issue with them, and where we've been kind of concerned that they might not participate. Here's the Northeast section. So you can see these are all the counties in the Northeast section. It's a much bigger region than the Northwest. You see more of these red boxes where where school districts have not participated. Usually they're pretty spotty. Most of the school districts still have participated every year of the survey. Most of the school districts are planning to participate here in 2023. You see Maxwell's refused, and they've refused several years in a row, but they've also participated. We hope to get them back on board at some point. Roy school district in Harding, well, Roy is, it's a very tiny little school district, and they have had a pretty good record of participation up to 2021. And I've always been really happy to have Roy in the survey. They often have less than 15 high school students. But to me, it's really important that we have these rural districts on board so that we can really really characterize those areas well. In 2021, they did plan on participating, and then they just couldn't, for some reason that we don't really have an explanation for. They couldn't get the survey done, didn't return data. We had more school districts like that this year that didn't participate in 2021. 2021, of course, was a year of COVID. So while people were in chaos, we have to acknowledge that, and there were a lot of intentions to participate in the survey, but I think we have about 4 school districts, maybe, or 6. We have a handful of school districts that did plan to participate in the survey, but did not end up participating. So again, there can be reasons for that, but you can also see that Roy has refused to participate for 2023. And I think, these are probably not unrelated. If they actually ended up not participating in 21, then it's probably just easier in 2023 to not even plan to participate. So, and I guess, here's another. Des Moines is kind of a heartbreaker to me because they have this perfect record of participation until 2021, when they didn't do it. And in 2023, they have so far refused participation. You can see that Quest is pending. We are optimistic about getting them on board, but there's a little more resistance there this year. They want to take the survey to the school board and see if the school board will approve it. They have not done that before. And the metro area, so the metro area is this kind of central core that is Albuquerque and all the areas that are adjacent to Albuquerque. You can see very good record of participation in the metro area, and even Rio Rancho has had a perfect record of participating until 2021, since 2011. So for 10 years, they did really well with the survey, and they have told us that this year they're planning to not participate in the survey. This is probably the kind of the biggest blow that we've had this year, is to lose a school district of that size. We do hope to get them back on board. And the Southwest region, always very good participation in the Southwest region. And the Southeast region, you can see this is the area where we have historically had the weakest participation, though still you can see that most school districts are participating. But a lot of them have kind of spotty participation, and this year it's looking like we are facing a little bit more issues there. Whoops. Sorry, I don't know what's going on here. Trying to stay on this page. Okay. Tatum is an interesting example here. They have had agreed to participate, and they started to maybe waffle a little bit about it. And there was some kind of communication problem there. They simply didn't understand from what we told them first that they could have parents opt out of taking the survey for their kids. And once they learned that, then they went ahead and accepted the survey. So, you know, with some communication, we can kind of correct that. You can see we're kind of running into a rough spot in Roosevelt County. We have 3 of the 4 school districts there that are refusing. So overall, it looks pretty good. We've got good participation promised for 2023, but with some kind of tough spots we need to get over, and we need some help with that. So how does that participation affect the results in the survey? Well, if we look at current drinking by region, you can see that in some cases, as with current drinking here, we do see a wide variation in the rate of risk behaviors by region and by county. And here we can see that the lowest rate of current drinking is in the Northwest region by far. And this has been very consistent throughout the years. And the highest rate of current drinking is in the Southeast region. So, and the Southeast region has about twice the rate that the Northwest region. Well, the implications for programming for alcohol prevention are pretty clear with this, I think, and we've always had very good participation in the survey. These are representative rates, and we have really high confidence that these differences are there, and they need to be addressed. But then the question is, what if we didn't have as good a participation in the Northwest or the Southeast? If we lose several school districts or large schools in one of those regions, we're just going to be less confident of the results. And if we've already seen that Farmington, one of the largest school districts in the Northwest, is a school district that's participated every year for the past 20 years. If we end up with out Farmington and a few others back out, we end up with poor participation, we will lose some of the confidence that we need in our data, and we'll lose confidence in its use for program support. We really need to have Farmington on. We need to have all these school districts on. Another case where we can kind of see what difference participation makes is when we look at differences by urbanization. So there's a few cases where we see very large differences between rural and more urbanized areas. And one of these areas is for spit tobacco. You can see that the rural area has a much higher rate of spit tobacco use than any of the other 3 areas, 3 types of urban regions. So we need to really encourage our rural participation so that we know that we are correctly characterizing the concerns of the rural areas, and that we don't just wash away those concerns because the rural areas don't have the data. Well, you can see it from the list that we've seen. You see that the rural areas are the school districts that have the weakest participation. So we really need to protect that, encourage the rural areas to participate in the survey, because we know this difference exists. We want to make sure that, you know, we don't lose them. If we lose representation in rural areas, we will not really be able to see these differences. And then again, the good news about all this is that the YRS is large and a robust survey. It's a project that has a history of representing youth concerns in our state very well. And we have had good statewide support up to now. And it's a strong survey, again, robust. We can take a few blows up to a point as far as participation goes. So take the hopefully hypothetical case that Rio Rancho would not be participating in the survey. And take at the same time the case of marijuana use. So the current rate of the marijuana use in Rio Rancho is similar to the state rate. Rio Rancho is a very large school district. It accounts for about 6% of all the results in the survey. But if we remove them from the 2021 data, we don't really see very much difference in the state rate for marijuana use. So this is the state rate for marijuana, 20.3% of the kids are marijuana users. If we pull Rio Rancho out of that, it's really no difference at all. We don't see that difference for Rio Rancho. We also don't see very much difference if we in our regional rates. So in that whole metro area there, we don't see much of a difference if we pull Rio Rancho out of that. But as we've discussed, the county data are really important to this survey. When we pull Rio Rancho out of Sandoval County, then we do see a huge jump in the rate of current marijuana use for that county. So for county planners, losing Rio Rancho from the survey, this would really be a significant loss. It would lead to overestimating youth marijuana use throughout the county, and possibly misplaced priorities and resources would go to that sort of thing. So it's really not a trivial thing that we are running into these problems with participation in the state and in some of these large and smaller school districts. So I hope that all makes sense up to this point. I'm going to turn this over to Courtney now, who's going to talk a little bit about what it's like to talk to school districts and try to get them to agree to participate in the survey. Courtney?
Thanks, Dan. So hi, everybody. My name is Courtney Fitzgerald. I'm a senior research scientist here at the University of New Mexico Prevention Research Center, where our team is in charge of getting clearance from school districts and schools and administering the YRRS every 2 years in the fall semester statewide. And I think this year we have 410 or 11 schools in the sample. So we've got a big job to administer the survey this fall, but we are ready to go. I wanted just to give everyone a little information about the reasons why districts and schools sometimes refuse participation in the survey. So one of the main reasons is to protect instructional time. As you guys are probably aware, schools have a lot of stuff that they're responsible for. They are held accountable by school boards, which are elected by the community, and they are, trying to keep up with kids' academic needs, but also their social emotional needs. And a lot of the times there's doing almost as much social work as they're doing education. So they do have a lot on their plate. And sometimes they see the survey as kind of a burden. So one thing that we want to point out to schools when they're concerned about protecting that instructional time is that we do this survey every 2 years. It takes less than 40 minutes for students to complete. Usually we do it in a sample of classes at most schools, unless the school is very small. If we've got a really small school, then we try to survey every kid so we get a good enough number, right, for at least county level data, if not district level data. But for most of our schools, we're doing a sample. So every 2 years, about 30 to 40 minutes in just with some of your kids, we try to reduce the burden on schools as much as possible. And for now, this is the only health survey that PED and DOH are asking our schools to administer. And we've really tried very hard to make this minimally burdensome. Everything is provided for free. We work with a coordinator at the school to get it out and back and we've got it down to a science. We really do a good job, if I do say so. My team is awesome at getting this done really expediently. So that's the first reason. The second is coming up a lot more this year, and that is that questions on the YRRS are seen as inappropriate, especially for younger adolescents, or even harmful. So our response to that is that we've been doing this survey for more than 20 years in New Mexico and nationally, and there's no evidence that participating in the YRRS causes young people any harm. And in fact, if you look at trends from our survey over 20 years, you see that there are decreasing rates of drug and alcohol use and tobacco use, sexual activity, and violence among our New Mexico young people. So if participating in the survey actually caused them to engage in those behaviors, we would probably see an upward trend, since they're doing it every 2 years over 20, but we've seen decreases. And there's also evidence that asking young people questions about some of these risk behaviors, especially mental health questions about suicide ideation and attempts, actually can be beneficial, because it might prompt young people to go and seek help for something that they hadn't acknowledged for themselves before. So there's actually some evidence that asking young people questions about these things can be beneficial to them directly. Another common reason we get is that the school district is overwhelmed. That's something that happens periodically, especially in small districts where the superintendent is driving the bus, teaching 2 classes, trying to manage the staff of everybody else at the school, and serving as principal interim because the principal left. But oftentimes schools are just in a state of chaos. Maybe I think 1 year Las Cruces got hit with a malware attack and everything was chaos for them. So again, we just stress that we've designed this survey to be administered in a regular classroom setting. The teacher just passes out the materials and collects them back for the students. We provide everything at no cost, and we work really closely with a coordinator to handle the logistics. The school gets to pick the day for the survey and which class period to administer the survey in. So we try to make it as convenient for the school and as easy as possible. And furthermore, we want to stress that the data from the survey can actually help bring more resources to the community, which might take some of the burden off of the school staff. If there's more resources available to help young people with things like substance abuse or alcohol prevention, then it might help the staff free up their time a little bit more too, and actually help the schools with that problem of being overwhelmed. And finally,
Courtney, I wanted to
Yeah.
say we had a question in the chat about this that I thought was a great question, and I don't know if we have an answer right now, but maybe we can get some people's ideas and brainstorm for a minute. But John Kutenak, so sorry if I just mispronounced your name, John, but he wrote, I would love to hear ideas and strategies around how we can reduce administrative burden on the schools around YRS, and how we can support schools so we can get more schools to participate. And then he asked CHWs, health councils, PTAs. So are there ways that people like the people on this call, or those that John mentioned, can help reduce the burden for the schools?
Can help reduce the burden? Yes, actually. So we've actually had folks from communities before, and I'm not sure if anyone on this call has done this, but I'm betting probably somebody has, go to the school on the day that the survey is supposed to be administered and actually help with passing out the materials and collecting them and sending them back up. So you can actually do like on the ground real-time help, which is super whenever schools can get that help. Sometimes they really appreciate that. We also switched recently to an electronic administration. In 2021, the CDC made it possible for the first time for YRBS participating schools to do the survey electronically. And we actually had more than 75% of our schools, I believe, participate in the web-based survey. So that reduces the burden on teachers of managing paper and getting the answer sheets back and shipping things back to us. So it also takes less time for them to do it electronically. So those are other ways that we've been working to kind of reduce the burden on schools.
And Courtney, I don't want to interrupt you because I see you've got one more point here to make on usual reasons for refusals. So after you make that point, I see we have a couple more questions that we'll address when you are ready for them.
Sure thing. So yeah, the last point is one that we kind of maybe a little frustrating for us, but when a superintendent says, oh, we're not interested, or it's not relevant to us, or we're too busy. So in that case, it's really important for the people who use these data, especially at the local level, to talk to superintendents and principals about how they use those data, what kinds of resources they've been able to enhance or evaluate or bring into that community using those data, and if possible, how they've been able to help young people. Because one thing I've learned from working with principals, teachers, and superintendents over years is that they really care about the students in their community. They really, really care about their well-being and their education, and they want those kids to be healthy and safe and finish high school and do well in school. So it doesn't help a lot when my team says, oh, well, these data become part of the national data set and the CDC needs them because it's part of surveillance and we're monitoring health behaviors. They don't care. When we say the Department of Health uses it for policymaking and decision-making about funding, they care a little more, but still not as much as they care about how the data help their kids specifically. So this year I have a couple of quotes that illustrate some of these points, but by far, number 2 has been the most popular reason this year. We've heard our community will be uncomfortable with many questions about sexuality and gender. The content is inappropriate for younger adolescents. The survey content and vernacular do not serve the best interests of our students at this time. We're concerned about losing ground on many of the changes we're making at this time. Our community is very conservative and we want to avoid pushback. And we want to avoid growing parent pushback over YRRS content, e.g. questions to 6th graders about sexual intercourse. So as Dan mentioned, we have districts that had said yes to us in the spring, which is when we began making phone calls to superintendents to get their clearance. Districts that had said yes are now kind of waffling and now doing things like taking the instrument to their school board or beginning to push back and say, maybe we won't do this after all, and ask more questions about how they can protect themselves in the event that parents become upset, for example. So that busy, not interested thing is definitely come up to with one superintendent. I just didn't write it down. And I saw who makes decisions at the school or district. So the person making decisions at the district level for our purposes is the superintendent. For charter schools that are state chartered charter schools, it's the school principal. And so once we get superintendent approval at the district level, that opens up our process to begin contacting the principals in selected schools for their approval. So we get superintendent approval first, and then the second level is principal approval. We ask the principal to name a coordinator for us to work with, and then we work with that person to do the survey administration. Rita wants to know if the surveys are available in other languages. We offer all of our surveys in English and Spanish. And in fact, with the electronic survey, it's been really great because we send out access code cards to students. Before, we had to send a certain number of Spanish hard copy surveys, right? But now with these access codes, we actually have them in English on one side and Spanish on the other. So now students can decide which survey they want to take. And we actually saw an increase in our Spanish responses when we started doing that. So that was really exciting. Do the questions change every year, and how are the questions selected? So they change minimally every year. Most of the questions in the New Mexico YRRS are from the CDC's YRBS instrument. We have to keep at least 60% of those questions to still be part of that whole surveillance system. But some of the questions in the New Mexico survey are added. So those resiliency or protective factors questions, for example, are specific to our state. The process for adding questions to the survey is really, really difficult because for every question we put in, we kind of have to take one out. And since this is a really broad surveillance instrument, we're asking questions about so many different things. It's difficult to take one out because other people are relying on that question. Even the carrots question, those of you who know us know we complain about the carrot question like all the time. How often do you eat carrots? That has to be in there for the dietitians and the nutritionists and the people who are doing healthy eating, just to make sure that young people are getting appropriate nutritional value in what they're consuming. So if we take out the carrots question, they lose something really important. So I hope that answers that question. If you want to know about what that process is like for adding questions, we have a form. If you have a question that you're really eager to see on the survey, you should contact Dan. He's the person who would begin that process. And Becky's answering those questions too. Sweet. Okay. So I will move to the next slide, Dan. So for 2023 so far, we have 79 out of our 89 school districts, which is 89% that have accepted. So 10 of them are currently saying no, plus Bureau of Indian Education and state charter schools. So we kind of count them as districts, even though they're technically not. So we have 91 total. 11% of our districts are currently refusing to participate. So we will be missing representation from young people in those districts, which is unfortunate. And here are, Dan already went through that big giant spreadsheet, so we'll just show you. These are the districts that are refusing in 2023. And that's all 10 of them. And I just wanted to point out some things we're doing, because a lot of the communication we're getting from our superintendents has been around parent concerns. We've made an extra effort this year to provide schools with communication resources so they can let parents in their communities know that the survey is coming, because this is an optional survey. Parents can opt their children out of the survey, and students don't have to answer any questions they don't want to answer. They can choose not to participate, and teachers are instructed to let them make that choice. Don't force them to do it. So we have developed some social media posts. That pretty green, here comes the YRRS, is part of our social media post package, where they can put those up on their social media sites. We have those in English and Spanish. We have email and text message content in both English and Spanish that schools can use if that's their primary way for communicating with their parents. And we also have a consent form that goes home with students who are in the classrooms that are selected for participation. And that's an opt-out form. On that form is a QR code. So all of those communication materials and the consent form will link parents to a new parent page that we've added to our website, which is not quite ready to go live yet, but will before we start survey administration. That page has the questionnaires, so parents can review what questions their students will be asked. There is a frequently asked question page where they can find answers to questions like, how often do you do this? How much time does it take? Who is the person responsible for this survey? Also, we link them to the CDC's YRRS site so they can see how New Mexico compares to other sites, and there's a place for them to contact us. There are also a couple of video resources on that website for parents that the CDC produced. One is in English, and one of our staff, Oscar Mendez-Serra, has translated that and done that video in Spanish as well. So we have the video explaining to parents what this is and how we do it. And finally, there's a place for them to click and access that passive consent form or that opt-out form. So if they want to just fill it out preemptively and send it into their school, they have that option. So with this approach, we're hoping to make sure parents are informed, that they feel like they knew this was coming, and that they know they can opt their child out if they want to. We're hoping to avoid any situations where parents find out after the fact that their child took the YRRS and then get upset about it. So we're hoping that these materials will really help schools feel more comfortable with letting parents know. And I think, is that all my part?
That's it. Yeah.
Okay.
Thank you, Courtney, very much. I just want to add one thing to that, and I did mention this earlier, but we did have one school district that was starting to waffle on participation until they were explained this parent opt-out piece here. So once they realized the parents could opt out, as is shown here on this slide, they opted back into the survey. So I think we're already seeing that this kind of parent outreach is going to help our survey in the long run and in the short run.
Dan, you have a couple questions about data. Christina said CCSD. Christina, is that what? Central Consolidated School District? In San Juan County is not mentioned in the first section of the report. Do you know what their participation was like?
Their participation has been golden. They've participated every year of the survey. It should be in that report. I will go back, and if it's not in there, I'll add it and give that report back to you, Wendy, so you can distribute the correct one. But yeah, we've had great response from Central. Yeah.
Okay, great. And Rita wants to know, how do you capture data from families that might not have access to technology? How does that work, that technology option?
So the survey is administered in schools, in classrooms. So it has not anything to do with technology that families have, but the technology that's in the classroom. So we prefer, and we ask schools whether they do have the correct technology and capability to do the electronic survey. And most of them do that now. For those that don't, we do have a paper option, so they can fill out the survey as a paper survey.
Okay, great. And do you have a list of BIE Pueblo Day schools who have participated and or refused?
We could get that for you. There's not very many, and they're most of the BIE schools are grade schools. So once we get into junior and high school, there are fewer BIE schools. We go to, I think, about 4 or 5 BIE schools totally. Yeah.
Okay.
And yes, I see Courtney just added to the chat that the Albuquerque Area Southwest Tribal Epi Center has programs with these schools, and so those are they get special care from from the Aztec people, and they get products that are really tailored to their own schools and communities because of that participation of Aztec.
Okay. And then Matt, I see you have a question about the marketing materials. Is this something maybe you want to explain briefly and then maybe get in touch with the team on?
Sure, that's fine.
Okay, you're going to get back. Matt has some questions about marketing material. So he's got a recommendation for you maybe about branding. And Matt, who should he get in touch with?
I think any of the 3 of us is good.
Okay.
And we'll give you the our contact information is on the last slide of this presentation, and I think it's also in one of the handouts that should be distributed to you after.
Great. And then
afterwards.
Dan, Courtney, Becky, before you leave, could you just put your emails into the chat for those people that want them immediately?
Sure.
Okay.
Great. So
Thanks.
if we can just move forward quickly here, I think we're just getting to kind of the whole crux of this, which really is that Department of Health, Public Education Department are really asking for some assistance in getting this done. So we would really appreciate it if health councils in particular can organize themselves, or as individuals contact some of the school districts for us. So this is our big ask for today. If districts in your county said yes to the survey, we really would appreciate if you could contact the principals and the superintendents in your district and say thank you for participating in the past and in the future. Let them know how you use the YRRS and how it benefits the students in your area. And please do this by, however is convenient, by email, by phone, in person. Meetings are always good. If you can get in with a busy superintendent for an in-person meeting, that's fantastic. And then if the districts in your county said no, that they can't participate, again, contact them. Please ask them to reconsider, let them know how. the community uses the YRS, how it benefits the students through programming, how it benefits the community through grants. Again, email, phone, in person, it doesn't matter. And please, you know, if you can organize the health council to get a lot of people to contact the superintendents, that's great. If it's easier just to do it as individuals, please, as individuals, call the school district superintendent, call the principals, ask them to reconsider. And if you can get other people in your community to do the same, that would really help us a lot.
Well, Dan, and I was going to mention John had that good idea too about if the school's feeling overwhelmed, potentially offering or finding other people who can help the school on the day of administration or reduce the administrative burden in other ways.
Absolutely right. If that is their big concern, that they just don't have the people power to get it done, there are options, and we have relied on community people in the past to help us through that. We've even sent people from Albuquerque and Santa Fe out to schools to help from time to time when they really can't do that. So if that is their issue, we can help with that. So again, these are just talking points to help you get thinking about what to say to superintendents, principals. These are in the handouts that we're giving you. Again, what we really want people to do is to call, either thank the superintendent for participating or encourage them to participate if they seem like they might not participate. Again, let them know that you and other groups in the community are using the data for implementing programs, for encouraging grant support, and really remind them that regular participation is the only way to track trends that are necessary for prevention programs. And so there's a couple of data points here that are important and impressive, I think, to people who are wondering about the YRRS. We can get you data at your county level, or at your county level we can get it. School district level is a bit trickier. And again, talking points, use the ones that you think make sense in your area. Maybe some of them don't make sense. Here's one that is impressive to some people, but as Courtney mentioned, people are maybe sometimes not so interested to hear that this is a national survey system. And it's important that we can compare New Mexico to other states that are involved in this survey. But we really can't make valid comparisons unless everybody is participating. And, you know, sometimes rural districts are impressed that with the argument that if the rural areas don't participate, then our state data are just represented by large school districts like Albuquerque and Las Cruces and Santa Fe, and that we really need the rural districts to give a true picture of what our state is like.
Hey, Dan, we have a hand up from Shara Thorpe.
Okay.
I know we only have a few minutes, but you segued beautifully into something I wanted to add. I'm Shara. I represent Southern New Mexico. I work with our Southwest and Southeast counties here in the Southern region. So I'm kind of a little bit of an expert on working in rural communities. And so if anybody in this call wants to have a further discussion about how to approach their district, I recently just approached Sierra County, who for years opted out of the survey. And I was able to sort of sweet talk them into getting back on the survey. And so my advice to you all, in thinking about Roosevelt, which is in the Southeast, we have to use the champions in our community. And I think coming from the state level, rural communities, especially Southern New Mexicans, do not like us state people coming into their communities and telling them about this stuff. And so I think how I was able to find some success was, one, I have a relationship with that rural community. They trust me. And so if anyone's going to be brave and try to approach Roosevelt again, I totally encourage you to do that. I think there's a way to approach these communities and rephrase the way we're talking about it to get more buy-in. So if anybody wants more support, holler at your girl. I'm here, I see you, and I support all of you.
And Shara, you're going to put your email and or phone number in the chat right now, right?
Yes.
Okay, thank you.
Thank you, Shara. That is a fantastic story. Thanks so much. And
And I see that Nicole has volunteered to call Roy. So go, Nicole.
great. Thank you. I would just, I would add to what Shara said. I have spent a lot of time, not as much time as the UNM team has, but I spent a lot of time on the phone talking to school district superintendents, trying to convince them to participate and telling them why it's important. And you know what? I don't spend much time doing that anymore because they don't want to hear about somebody from the New Mexico Department of Health Santa Fe office telling them how important the survey is. They want to hear from people in the communities. And that's the only thing that seems to help us out, really. So it's absolutely true what Shara said, and that is really the whole purpose of why I wanted to do this presentation today. Really
And you
appreciate all the
have
help.
3 more minutes, Dan, and a couple more slides. Do you want to go through those slides?
Yeah, sure. Well, this is about it. Review the talking points. You'll have those. Use the ones that you want. And then we do want to direct you to our website, youthrisk.org. There's a lot on the website that is helpful, county reports and other things too. Let's see, are there some questions we should take right before we close here? See, we do have a hand up.
Oh, yes, Geraldine, our tribal rep.
Hi, Dan. Thank you. I had a question about the counter reports, and I'm curious if all the data and the reports are at a county level, or if any of the data is aggregated to show like the American Indians and Alaska Native students in the reports.
The county reports are of county data. Most counties are pretty, there's not a lot of diversity in many counties because they're small by race and ethnicity, and it is often just too difficult to make those cuts at that small level. So for many of the counties, we can get you county data by race ethnicity for American Indian students or other race ethnicities if you want, but you just need to contact us because it's not in the county reports.
And
Thank you so much.
we have a few hand ups, but before we go to the hands, everybody on this call, if you would like a copy of the handouts, make sure that you have your name and email in the chat, because that's the group that we will send the handouts to first. They will also be available later, but if you want the handouts right away, be sure your name and email is in the chat. Thanks. Okay, John, and then
yeah, just real quick. So I'm the Southwest Region Health Promotion Program Manager. Thank you all for this presentation. I think it was really, really excellent. And I just wanted to throw something out there as well to the health councils and the health promotion team that's on this call too, is, we're all working really hard. We've done tremendous work around our community health improvement planning, right? And our state health improvement planning work is happening. And if you look at what was presented today, it's glaring, right? Behavioral health, social determinants of health, those kinds of those are the priorities, the things that we're seeing. So I think the more we can use this, this data is great. So that was the one thing I wanted to say from a systematic point of view. And then the other thing that I was thinking as Dan was talking is that the health councils, one role that maybe the health councils could play is knowing the day that maybe the school is doing the survey. Maybe the health councils could go in and do little maybe goodie bags for the students, or do little fun things, right, to promote the health council, a little care packages. Schools really love that kind of stuff. And so those are just some thoughts, kind of find out what the schools need. And how we can support them on those days or leading up to the survey. So just some ideas that I had. And again, just thank you, Courtney and Dan and Rebecca for this great presentation.
great. And the last word goes to Nicole from Roy. I assume.
Yeah, so Nicole Romer, I'm a health promotion specialist and I cover Harding County. Hi, Dan. Great presentation, but I also wanted to just kind of clarify, is it just the Roy schools that did not do the YRRS, or is it Roy and Muscaro?
Neither did last year,
Okay,
2021.
okay, I'll go ahead and give them both a call and see if we can get them signed up.
Yeah.
Excellent.
And I think they are some of the schools that really have, I mean, they're small districts, and like Courtney said, you might be the superintendent, bus driver, teacher, and do everything. And it is really difficult for them to maybe do something extra, but we
I
appreciate
agree,
it
and
and
I
we'll
can
work with
always
them.
go down, I can always go down there and help them do the survey. You know, and the health council over there is pretty amazing, so we can definitely get something worked out.
Great. Well,
Thanks.
Sarah said yes, Nicole.
Great.
Dan, and team, Courtney and Becky, I really want to thank you for volunteering to present this information to us. So important. And this fits right in with the Health Council and Health Promotion Team and all of our community members. I'm sure they're very concerned about this, and I'm sure they will rise to the challenge and help us see if we can't get this invaluable information out of our school districts with a lot of help. So thank you again, really appreciate it. I really appreciate all of you who showed up. Thank you, stay tuned, make sure your name and email is in the chat and we'll send you the handouts, and including Dan, Courtney, and Becky's email addresses so you can get in touch with them. And let's talk again, Health Councils and Health Promotion Team in particular, let's come back and talk again about what we can do. Thank you all. Have a great weekend.
Thank you. You too.
Have a
Thank you.
wonderful weekend.
Everyone.
Thank you.